Hi guys, welcome back to our channel. I hope you all are doing good. So today we are going to see a small technique of suturing which is known as figure of 8. So in this the suture is tied in the figure of 8 and hence the name is given. This is most commonly used for extraction socket closure as well as adaptation of gingival papilla around the tooth. So this is mainly related with the dental surgeries. So the technique here is, as you can see in the video, the needle first inserted into the outer surface of the buccal flap and then the lingual flap. Suturing begins on the buccal surface 3 to 4 mm from the tip of the papilla, and then the needle should be inserted in the same fashion at a horizontal distance, and then both the ends should be tied. The end should not be tied very loosely, or it should not be very tight. And the advantages of this suturing technique is that it is very rapidly closed, so it has a rapid closure advantage, and the disadvantage is due to its orientation. It is difficult to remove and it leaves a significant amount of suture thread inside the socket. So this is the disadvantage. So this was all about this video. I hope you all liked our video. And if you have any query, you can ask in the description, or you can DM us on Instagram. All the links are in the description box. And do subscribe to our channel. Please support us. And thank you so much for watching our video.